Hi, I'm Dr. Steven Sinatra, and I want to just try to update you on the swine flu. You know, it's been in the news lately, and people are worried. My patients have asked me, my family, my friends, and I want to tell you what to do. First of all, remember this. We have seen a swine flu before, and it hasn't killed thousands of people. It is a serious flu, but it's not as dangerous as the bird flu. That's a real dangerous flu. So after considering that, we have to consider how can you protect yourself if you do get it. Well, first of all, personal hygiene is the most important thing. You need to wash your hands often. If somebody sneezes who has the flu and shakes your hand, you're most likely going to get it. So hygiene is crucial. The other thing is you need to take in a good diet. Lots of fresh fruits and vegetables, lots of polyphenols, which have a nice antioxidant effect. You need to get plenty of rest and avoid alcohol. Remember, alcohol and sugars feed the flu virus. Now, what can you do to prevent the flu? Well, there's a lot of things I like. First of all, I like licorice root. You know, one of the reasons why Tamiflu may be effective is at the base of Tamiflu is star anise, which is licorice. So licorice root has some remarkable properties in that it helps to actually kill the flu virus. In fact, when the SARS virus was prevalent in China and in Toronto, what researchers found was licorice root was better than any of the conventional medicines. So think about licorice root as a preventive. The problem with licorice root is, however, is that if you do have high blood pressure, you don't want to take it more than 1 to 2 weeks. What else do I like? I like N-acetylcysteine. This is a fancy word. It's considered a tripeptide, but what it basically is, it's an amino acid complex that's broken down to glutathione in the body. And glutathione is the body's most powerful immune antioxidant. So studies have shown that if people take 1,000 milligrams of NAC, N-acetylcysteine, and it's broken down to glutathione, these people actually have a less response to the flu, and they get better 2 or 3 days quicker. I also like certain herbs. Black elderberry, for one. Black elderberry is an herb that helps to combat the replication of the virus. A similar herb is resveratrol. Actually, resveratrol is found in the red grape. It's found in the skin of the red grape. And it has remarkable anti-aging and antioxidant properties. And what resveratrol will do is it also helps to prevent the replication of the virus. In other words, it's not the flu virus that's so dangerous, it's how the body's immune reaction reacts to that flu virus, and the body creates a lot of inflammatory messengers called cytokines. It's these cytokines that literally can cause hemorrhage in the lungs and can cause tissue death. If you take quercetin and you mix it with a little bit of bromelain, like maybe 1,000 or 1,500 milligrams of quercetin with a couple hundred milligrams of bromelain, you can intercept and neutralize the cytokine storm and thus preserve lung tissue. So I really like that combination. I also like vitamin D, for example. Vitamin D, 5,000 units a day will absolutely rocket your immune system and support your immune system. One mineral I really like for the flu is selenium, and I like 200 micrograms a day. And I'll tell you why. Selenium makes your white cells more effective. They make them more angry. And if you have better, what we call phagocytosis, the virus can be eaten up very quickly by these white cells because of the action of selenium. And selenium is one of the most important factors in the immune system because it combines with glutathione and it forms glutathione peroxidase, which again is a very powerful immune system support. So in summary, taking nutraceuticals, taking minerals like selenium and herbs like resveratrol, these are some of the Sinatra solutions I want to offer to you. So the Sinatra solution is for any flu to help actually prevent the flu, or if you come down with the flu, give you some more immune support. So how do you know if you have the flu? Well, first of all, most people feel dreadfully sick. They have headache, runny nose, sore throat, cough. You may have GI complaints as well. You may have diarrhea, but most of these people feel like a truck hit them. What do you do if you have the flu? You get plenty of bed rest, take plenty of fluids. When do you see your doctor? Well, if respiration becomes a problem and you can't breathe, or if you can't sleep, you're coughing all night and you just feel like you can't get enough air in, that's the time to call a doctor. If you get the flu, if you get it, don't think you're going to go down a tube, so to speak. You got to have positive intention. You got to think positive. Remember, a flu-like illness only lasts for a few days. You may feel sick, but tell yourself you're going to get well. Now, I want to talk about vaccines because this is a very delicate subject. Who should be vaccinated? Well, this is a difficult situation. If you're of school age or an adolescent or if you're in your 20s or 30s, I would recommend vaccination under these circumstances. But if you're someone my age, or if you're someone even older, and you're not compromised, you don't live in a nursing home, you're in good shape, I would not recommend vaccination because, remember, we've seen the swine flu before. It occurred decades ago. So some of us have a natural immunity at this time. However, the young adolescents, particularly late teens and early 20s, and pregnant women, these people may be the most susceptible because their immune systems are very sharp, they're intact, and they possibly have not seen this virus before, so they may be the most susceptible. I am very concerned that vaccinations aren't for everyone. Certain select people need to be vaccinated. Everybody needs to make their own decision on this. And I worry about young mothers with young children because they're going to have a lot of pressure. They need to talk to their doctors. But in your heart, everyone needs to make their own decision about vaccination. I really believe that the media must take responsibility in creating a lot of fear about this flu. Look, we've seen this flu before. This is not the pandemic of 1918. We know what to do with this flu, and it hasn't killed millions of people like the pandemic in 1918. Think positively. Drink a lot of fluids, get some rest. Think that you will get well, and you will get well. You must give yourself positive intention. That's the greatest asset in combating the flu.